breathe in. Hold your breath.
This screening alerts patients to one of the deadliest cancers in the U.S., but it's not for everyone. Coming up, we meet a man who took time for this simple test and then later discovered he had lung cancer. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Lung cancer is by far the leading cause of cancer deaths in the United States. In the U.S., on average, someone dies from lung cancer every 4 minutes, according to the American Cancer Society. That is roughly 350 people dying every single day. An estimated 85% of all lung cancers are caused by smoking, although it's still possible for non-smokers to get lung cancer. On the brighter side, though, as tobacco smoking becomes less and less common, the trends in deaths and diagnosis are improving. But what about the millions of Americans who do smoke or had that long history of smoking? They are not powerless. Today, we are exploring the best method for catching lung cancer early. It's called low-dose CT scans. And that is how our guest, Scott Carr, learned that he had lung cancer. We're going to learn a lot more about your journey to getting here with us today. How are you?
Good. Very good. Thank you.
Good to have you with us. Along in studio with us is your thoracic surgeon, Dr. Jordan Wilkerson. He's going to help us understand how you were treated. Dr. Wilkerson, how are you?
Good, thank you very much.
Good to have you. We brought these two together because we wanted to share an important story, because in just a few weeks, you can participate in a low-dose CT lung screening at our Indian Creek location. You can scan the code right there. For more details, we're going to share this throughout our program this morning, as we want to make sure you have plenty of time to make an appointment for anything you learned today. Sounds like you or someone you love. So Scott, to qualify for the low-dose screening, as we mentioned, you have to have quite a long history of smoking. What was your smoking history?
Oh, I started when I was in college. Like many young people, upon emancipation, I just,
It was a thing to do?
It was a thing to do. I wasn't alone in doing it, and it just started a process where gradually I just became a committed smoker, and as I entered the business world, I continued smoking, and
you were saying, I think you just found reasons to smoke socially, I would imagine. My mother smoked. I just remember there always being a cigarette in her hand at any time.
I told myself that it relieved stress, and I did have stressful jobs in the course of my career, and so
just the thing to do.
Yeah.
How you unwind, and that's kind of what everybody else is doing back then.
It becomes habitual in terms of what time of day, and when you have your meals, you follow it with a cigarette, and it becomes part of your life.
And you had mentioned you knew smoking wasn't good for you. I think we all know that. But did you worry about the lingering health consequences?
In my 20s and 30s, I didn't really worry about it, and mostly because I could do things uninhibited. I didn't have any effect. I remember when it was controversial that the Surgeon General wanted to put the warning on the cigarette packs back when I was a teenager in the 60s. That was a big deal. Is cigarette smoking dangerous or not? And it was concluded, and our society understands today it's definitely a dangerous thing to do, but when you're young, it's not having any effect on you. You settle in your mind that this is just going to be a problem down the road someday, and I'll worry about it then.
And down the road always seems like quite a long way until you're there.
Yes.
You told us that prior to the lung cancer diagnosis, and we'll get to that, you had started on a journey to really improve your health. How many years ago, and what was kind of that? What really made you do that?
I was in my 50s. I was approaching, that age where, I had my healthcare history was if I felt sick, I would call the doctor and see if I could get an appointment and get treated. Or if I hurt myself in some way or another, I would go to the doctor. And there wasn't anything regular or routine about that. As I got older, I thought that, and my wife, her primary care physician, is associated with KU Med, and so I sought out and found a primary care physician here, and the intention was just to have a regularly scheduled review with a doctor and a healthcare
Annual exam.
Yeah.
Getting your screenings.
Yes. And it was at my first appointment that I was with her that I was, it was suggested that as a former smoker, I should have an LDCT.
So you get this low dose CT scan. What did they find at that first one you had? Because you've had two.
Yes. That first one was nothing problematic necessarily with respect to my lungs, but it did peripherally identify a problem with my liver. And that led to a referral to hepatology here at KU Med. I have been followed by those folks routinely since then. It turns out that I had a condition that's known as hemochromatosis, but commonly called iron overload disease, where my body just would not dispose of iron that is consumed in the normal course. And that's a result of a genetic mutation that happens to be something that I was born with and never knew about until I was nearly 60 years old.
So you get the CT scan and find out you have something
Yeah.
completely different.
Yeah,
Doc, is that typical? I mean, you go in looking for one thing and you find something else.
Yeah, it is actually very common. We're getting a lot of incidental findings from other things, not even just from lung cancer, but any kind of screening.
So then you had this second screening
Yes.
just this past January, is that
Yes,
correct?
correct.
And it revealed a nodule on your left lung. You went to Mayo Clinic, then you came back here. That's when you were introduced to Dr. Wilkerson. What did they tell you just when you learned now you have a nodule in your lung? Tell us what you heard.
My first indication that it was serious was that I was told at the point that the scan was done that I would hear something in a week or so. I had a phone call that afternoon. So that was a pretty clear sign that there was something alarming going on and that it needed to be looked into.
Dr. Wilkerson, we talk about a nodule. We hear that word, and they can be benign. But is that the same as a tumor? And how often does a nodule turn into something cancerous?
Absolutely. This is a great question. So a lung nodule is simply just any abnormal kind of growth or spot on an imaging, like a chest X-ray or a CT scan. And the vast majority of these are actually non-cancerous. So over 90% are actually benign. But there are some that we do worry about and that we want to watch.
So would you biopsy any nodule that's found? And
Not
did you with
necessar-
Scott?
No, not necessarily every nodule that we find. It depends on the size, depends on how it looks on imaging. Sometimes we can watch these things or surveil them. But in high-risk people that smoke, like Scott, when we see a nodule, we want to be more aggressive about that.
So you looked at the history and you're thinking, that could be quite suspicious. So tell us about Scott's nodule. Take us inside his body. What stage was the cancer at, and what were you seeing, and what concerned you?
Absolutely. So it was a 2.1 centimeter nodule. It was within the left upper lobe, so in his left lung. We actually took it out, and the final pathology report confirmed that this was a stage 1 lung cancer.
So is it we talk about cancers and there's different types. So what type of cancer did he have? And then we'll talk about the process to remove it.
Absolutely. So he had an adenocarcinoma, which is just a subtype within the realm of a non-small cell lung cancer, which accounts for the vast majority of lung cancers that we see.
So you remove it. Why not treat it with chemo, radiation, or even immunotherapy?
It's a great question. So for Scott's case, we thought this was early or localized disease, and that was amenable to resection. Alternatively, he could have had targeted radiation for these early stage diseases, but the goal is to remove it and treat it locally and avoid chemotherapy. That's usually reserved for more advanced disease.
So does that mean, as what I'm hearing you say, you can get in there and get it all out?
Yes.
Okay, so that means it's gone for good?
That's the hope, yes.
Okay, so did you have to remove some of Scott's lung during this procedure?
Yeah, absolutely. So anytime we're taking out a lung nodule, we almost always have to take out some portion of lung. In Scott's case, we're able to do a wedge resection, which was only about 5% of his total lung volume.
So how's Scott doing today, medically speaking?
Yeah, he's doing great.
And you have to, how often will you have to see him moving forward, even though we got it all out?
Yeah, so a great question. So anytime we're dealing with cancer, we always like to watch and surveil of someone to make sure there's no recurrence. So he'll be getting repeat scans every 3 to 6 months for a while, and then assuming those stay negative, we'll start spreading those out to about yearly.
So that's how you're doing medically. Scott, you're hitting the golf course, you're doing well personally, and back to life.
That was part of our conversations leading up to the surgery, was how aggressive to be with, if it was going to turn out to be malignant, do we take the whole lobe or do we just take a portion of the lobe? And because it was early enough in the evolution of the disease, I had the option available to me, at least that was my assessment, to in conversation with those who know better than me, to minimize the amount of tissue that had to be taken so that I could, continue to function unimpaired and play golf and walk in the mornings and
how do you
the
feel
things that
physically?
I feel fine.
You feel fine? You feel like you did before, or do you feel better since you've been taking care of your health?
I never felt bad.
Never felt bad?
I had no manifestation of ill feeling with respect to the lung cancer. I have fatigue from just being old, but
how's your golf game? Not affected?
It's never been very good.
so all systems
but
go.
that doesn't keep me from doing it.
Of course not.
My golf buddies put up with me, and that's all.
That's all you got to do.
That's the only thing that matters.
Well, we know many of you out there may have questions. You can use the chat, the thread there on YouTube, Facebook. You can email the Medical News Network. All that information is right there on your screen. So while folks are watching at home put their questions together, we want to again share some more details about that low-dose screening event coming up here in 3 weeks. The screening is on Saturday, November 9th, on National Lung Cancer Screening Day. The screenings take place at our Indian Creek location. And to qualify, you must be between the ages of 50 and 80, currently smoke or have quit smoking within the past 15 years. And when you smoked, you had to have a habit of smoking at least a pack of cigarettes a day for 20 years. So let's talk about smoking history, Dr. Wilkerson, because we gotta kind of do the math. There's something called pack years. Explain pack years, what it is, and then we'll talk about why that matters when getting that low-dose screening.
Absolutely. So a pack year is simply a way we quantify how much someone has smoked over the years. So to put it simply, it's how long you've smoked in the number of years multiplied by how much you've smoked a day on average. So for instance, someone that smoked a pack a day for 20 years would have a 20-pack year history.
So why the guidelines of 20 years of smoking? Does that mean that those who've smoked less than a pack a day for 20 years are safe?
So the 20 years, that's trying to identify people who we would consider high risk that will benefit the most from the screening. It's not to say that others with less of a history are not at risk, they're just lower risk. So we're trying to optimize the outcomes for people that are high risk.
And Scott, looking back, you would call yourself a heavy smoker back in the day. Maybe not in the moment.
I was a very
back.
consistent smoker, and yes, looking back, I was a heavy smoker.
If you could talk to your younger self, what would you say?
Oh, I would say that was foolish, and that I knew that at some point I would stop smoking. I just waited for it to come to me rather than me seeking out that process of, folks that stop smoking generally get to a point where they're just so disgusted with it, or at least those I've spoken to that had shared the same experience that I did. You just reach a point where you just don't want to even see them again, and that's easier to stop at that point.
But you had started down a good path of putting your health first. You were changing
Well,
diets.
I had already stopped smoking.
Right.
I haven't smoked for over 10 years, and to find cancer today where it wasn't there 5 or 6 years ago when I had my first scan done is an indication that these things have a long shelf life.
Well, it's also an indication, though, that you got your screenings. I mean, and that's the whole point,
Yes.
is that you put your health first 10 years ago, started making small changes, getting to your doctor, and then that led you to getting your screening, and that's why you're here today. So
Yeah.
we're glad about that. Dr. Wilkerson, why do they call it a low-dose screening? What are we getting a low dose of, and that's, and therefore, why is it so important? You have to be qualified and meet those qualifications.
Yeah, absolutely. So the CT scan, it's low dose, and by that it's a significantly decreased dose of radiation compared to a normal CT scan. It's just as effective of picking up lesions, and this is beneficial to people that are going to be getting repeated or annual screening.
Well, let's get to some questions from our viewers. Cindy says her older brother, uncles, and sister-in-law all smoked, and while some died of heart disease or other cancers, none died of lung cancer. Do genetics protect a person in some way?
There's definitely genetic components to everything about how someone will, respond to long-term exposure like this. It's very hard to predict, and not something we would recommend. Overall, smoking cessation is the best.
All right, got a couple of questions. Marsha wants to know, why is it so hard to catch lung cancer until it's been going on so long?
So in regards to screening and lung nodules, these are things that take years and time to develop. So we can pick something up when it's relatively small early on, but it may take time for it to really show and become something concerning, and that's why we do surveillance or watch these, and you get annual screening as well.
Yen Liang says there are reports suggesting that tumors in lung cancer patients might have spontaneous remission. What is your opinion on this? Remittent. Is that correct, Stuart? Am I saying that right? What was it? Remission, yeah, spontaneous remission. What is spontaneous remission, and what is your opinion on this? And is that true?
Not to my knowledge. I'm sure people are looking into this, but I would say the majority of cancers we would want to treat, we don't expect them to get better on their own. I've never seen studies to prove that, and so I think screening and identifying and treating is the best way to go forward.
Stuart wants to know how much of a lung can be resected. When do patients start to notice a difference in lung function?
That's a great question. This is very individualized because it depends on the quality of lungs, and that's where when we see patients in clinic, we do a lot of preoperative or pre-planning studies to evaluate how good of a lung function they have to determine how much we can take.
What if somebody is sitting at home, this is my question, and is fearful, maybe they're not at 20, maybe they don't have 20-pack years, but they're concerned. Can they still get the low-dose screening? Is it something you could pay out of pocket, or is it strict, no, you're not getting the screening because it's not worth the payoff?
Absolutely. So they can get it if they pay out of pocket, and I think it's relatively affordable to, where you go. But if you do meet the criteria, I believe it, and you have health insurance, I believe it is covered for free.
You can. Okay, good to know. Jennifer wants to know, when Dr. Wilkerson sees a lung, can you immediately tell that somebody is a smoker, or can you tell like how long? 5 years, 10 years, 20 years?
No, you can get a sense of it, but everyone's so different. I comment to my patients all the time about how good their lungs may look despite their smoking history. But you can definitely see some changes, but it's not consistent throughout everyone. Everyone responds very differently to exposure over time.
Gene wants to know, should the scans be like mammograms or PSA tests? He says he lost his wife to lung cancer, and she was never a smoker.
Yeah, that's the goal we're trying to get to, is to promote screening and make it more prevalent, just like lung cancer, or just like breast cancer is. Certainly there's more stringent criteria than others, but we're trying to maximize and identify the people that need it the most.
What is your biggest message to people when it comes to lung health and smoking? And especially, I mean, things have changed. I was just thinking what Scott mentioned, just that it became part of a lifestyle, but it was, and the Surgeon General, but it was like the commercials that used to run, you know, and just how, glamorous they were back in the day when I was growing up. So what's the message to young people now?
My biggest take-home points, number one, is stopping smoking at any point is the best thing to do to reduce your risk in the future. And number two, if you or anyone you love meets the criteria to undergo screening, it's definitely worthwhile to do, because we want to catch these things early before you develop symptoms when they're still treatable. And I think Scott's a great testament to that, where he wasn't having any symptoms at all, but we picked this up and treated it.
Scott, what about you? What's your message to young people who think about picking up cigarettes and starting that habit?
Well, I mean, think about it. I mean, you're inhaling smoke into your lungs. That can't be good. That's there's no way you can convince yourself that this is a healthy thing to be doing. And before you develop a habit, experiment with it, have your fun with it, with your friends and the like, but don't make it a lifelong crutch.
And you're a testament, though, to that. It's never too late to turn around your lifestyle. You said at 50, you stopped smoking and made this decision to turn.
Well, as I got older, I knew that I was getting closer to that point in my life where these things were going to be catching up with me, and that it would be a good thing for me to. When I was younger, if I knew that I was risking a few years of my life at the end of my life. That's one thing, but as you get closer to that point, that becomes a bigger deal, and so it was just something that I felt like was the wise thing to do, and I've done it.
And you walked your daughter down the aisle this past spring,
yes,
right?
That's true. That's true.
How great was that?
She waited for me for 25 years to do that.
Perfect. I like it. There she is. Well, congratulations. I said, hey, getting a kid down the aisle, that's a really good milestone. You said, not a kid anymore, but that's okay. That's all right. Well, thank you for sharing that. Dr. Wilkerson, any other big takeaways you want people to know as we wrap up today?
Just if you meet criteria, this is certainly a great opportunity to go get screened and provide some peace of mind and potentially pick something up that's treatable at this point.
Thank you for being with us. Scott, thanks for sharing your story too.
One thing else I'd like to say.
Jump in there. We got time.
It takes less than 5 minutes. It takes more time to make the appointment. You show up. There's no pre-scan prep work. At your appointed time, they take you into the room. You lay flat on a device, and the scan is done in minutes, and you get up and you walk out. It's a 5-minute thing, totally painless.
So don't let that keep you from getting in there.
There's certainly nothing about that should be an obstacle.
Thank you for sharing that.
Sure.
Thank you. Thanks to both of our guests. Thanks to our viewers for being with us today. We'll see you back here tomorrow. Coming up tomorrow on the Morning Medical Update, 2 sisters with the same concern, a lump in their breast. Their cancer diagnosis came just days apart. I'm Jessica Lovell on the next Morning Medical Update, how the different types of breast cancer changed each sister's treatment plan, plus their message for women everywhere, Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.